I'm Alex Lawson, filling in for Thom, and I am really happy to be joined in studio by the one and only Dr. America. Sanjeev Sriram is a Dr. America. You have a show on We Act Radio. You're
That's
also
right.
a practicing pediatrician in Southeast Washington, D.C.
Yep.
And one of the just most driven fighters for health access and for our healthcare that I know. And I get to spend a lot of time because, we work on Dr. America together.
Yeah.
So thank you for joining us here.
Oh, yeah. Thanks for having me.
And, I really, I want to tell people, we did this big event. It was the hands-off Medicare petition delivery in January. It was in December.
It was in December. The first week of December, yeah.
And right after the election, we really wanted to fight back hard. And we delivered over 1 million petitions. And Senator Sanders was there, Senator Schumer was there, Leader Pelosi was there. There are all these elected officials. We had all these experts. You were there. You delivered the petitions to Paul Ryan's office, which was locked.
Right. Yeah.
But there is this question that was asked about Medicaid.
Yeah.
And kind of the whole room was filled with people.
Yeah.
But really, no one was able to really So you were like, oh, well, can I go up? And then you answered this question, and literally everyone there was like, oh, that's what Medicaid is.
Yeah.
And that's exactly why I wanted to bring you on today, is because on Wednesday, we've been talking the whole show, they're going to unveil their secret plan.
Yeah.
And we know that their secret plan is going to have Medicaid in the crosshairs, teed up for destruction.
Yep.
What is it that they're planning on destroying?
So, I think in order to really understand what they're destroying, we have to value what's there in Medicaid, first and foremost. I think one of the things that I mentioned in December is that Medicaid is one of the most underappreciated programs in American healthcare. It's, doing a lot of heavy lifting that a lot of the private sector simply does not want to do, cannot do. And we have got over 70 million Americans who are living lives of dignity because of Medicaid. And I think Medicaid is one of those silent warriors that is day in, day out doing that hard work. And, as a pediatrician, I focus on Medicaid's contributions to child health first, obviously. But 1 in 3 American kids is covered by Medicaid. It's the largest insurer of children in the country. And I think that for my fellow Americans to understand what it is that we could be losing, starting Wednesday with what the GOP is targeting, what we could be losing, we won't understand it until we actually look at the people in Medicaid and understand that these are our fellow Americans. This is not other people's healthcare. I think it's one of the biggest misconceptions about Medicaid is that, that's other people, it's nobody that I know. And the truth is that it's actually 1 in 5 Americans is covered by Medicaid. So maybe one of these 1 in 3 children. It could be that one of the 6 million people with disabilities who's covered under Medicaid, 10 million seniors, 27 million low-income adults. So if you put together Medicaid, the Children's Health Insurance Program, and Medicare, you're talking about 1 in 3 Americans is covered by one of those 3 programs. So this is somebody that somebody on this program. And I think
I'm going to go so far as to say that someone on Medicaid.
Oh, yeah.
You might not know them, but you rely on them.
Right.
I bet you there's nobody who's not touched one removed by Medicaid.
Right. And I'm talking about if your kid goes to school and that there's an autistic student at that school. I'm talking about if you spend Christmas with a cancer survivor. Maybe in your workplace, somebody who is an organ transplant recipient. Those are all people who could very well have been, who are with us today, who are our fellow Americans because of Medicaid. And I think that this is one of the most underappreciated programs. And I think that one of the things that makes it so easy to attack is that the people who are getting, their healthcare through Medicaid are probably some of the most disenfranchised people in the country. They are, some of the folks who just simply don't have a vote. They're kids. And I think that that is where a lot of Americans are taking this program for granted, not realizing that Medicaid is not only taking care of all of these people, but it's actually helping keep the lights on at your local hospital. There is not one hospital in this country that does not have a contract with Medicaid, and that if that contract were to somehow be drastically altered, that hospital would be able to continue to have the lights on, continue to employ people. Maybe you've heard that your hospital wants to expand and put up more clinics in your neighborhood. All of that work is not going to happen if the Republicans attack Medicaid and are successful in their attack.
So I oftentimes focus on this other aspect of Medicaid, which you mentioned, which is it is the largest provider of long-term care in America. And in many cases, it is the only provider of long-term care. That is nursing home care. A lot of boomers who have just gone through this with their parents understand. Without Medicaid, they would have gone bankrupt.
Absolutely.
Caring for their parents, right? I mean, I really like... I feel like between you and I, you're focusing on like you're talking about children. Millions of children. Whose health care the Republicans are just going to blow up.
And the thing that I think what is really impressive about Medicaid is that it is doing a great job. Like the people in the program, when they are surveyed, they are telling us, it's not just me as a doctor who, I mean, my hospital has a contract with the Medicaid program. It's not just me as a participant in the program. It's the people receiving care in Medicaid when they are surveyed and they're asked, how do you rank Medicaid on, and these are the parent, and the survey that I'm referring to now is the survey of parents with special needs children. So these are some of the toughest kids to take care of because their health needs are complex. The parents are, working multiple jobs, trying to make it to appointments. So these are parents where, they're going to tell it like it is because they simply don't have time for any nonsense. When they are surveyed, 10 out of 14 satisfaction members, Medicaid is outperforming private insurance, according to the parents of the kids with special healthcare needs.
So, kids, children, their health care, some of the most complex cases, seniors, long-term care. There's this other thing that is between these two populations. It's not like there is this giant private alternative just waiting there, right? Like, oh, if only Medicaid would get out of the way, then there's nothing.
There's really
Medicaid is there because there's no alternative.
That's right. And we know this because of the Medicaid expansion successes in 31 states and Washington, D.C. When they expanded Medicaid, they brought healthcare to 15 million adults who had not had healthcare since probably their childhoods, at best, maybe a reasonable guess. And when you look at the people who are still uninsured in America, they are predominantly living in states with governors and state legislatures who are putting politics before patients and are not expanding their Medicaid programs. And if they were to, that 9% uninsurance rate would probably be down to 2, maybe 3% uninsured.
You're a doctor. Has an insurance company executive ever helped you give care to the children in your care, right?
That's a great question. I'm actually very curious if any insurance company executive has ever really visited Southeast DC and seen some real health justice at work. But the point that you're making about where does the money go? Like, what value are we seeing for the money that is being taken out of our paychecks, every pay period? In premiums. And when I hear my fellow Americans concerned about their individual market premiums going up, to me, I think it's very interesting that we have the scapegoat of the Affordable Care Act. Obamacare becomes this thing that everybody puts their blinders of blame on, and we ignore all of these other behaviors that are happening with insurance company mergers, with just endless campaign donations. There never seems to be a shortage of money for lobbying. But there always seems to be that they want just some more help to help our fellow Americans, when in fact these CEOs have collected multi-million-dollar salaries, multi-million-dollar bonuses. And if I was as bad as they were at participating in the exchanges, there's no way that I would be able to keep my job, much less my license. if I was doing that poorly of a job.
Because they're doing it on purpose. That's the That's the reason.
Sure.
And I said earlier in the show when I was just talking about, so I'm not here. I fought very hard for Obamacare.
Mm-hmm.
I fought specifically really hard for the public option. Medicaid expansion alone.
Yeah.
I come out of working in clinics and outreach clinics as a health educator. So I understand that even a small improvement in real people's lives, that matters.
Matters big time.
And so I'm proud of what we were able to accomplish with Obamacare. Yeah. But the fundamental flaw of it was it left the insurers driving the bus.
Yeah. You know, and I actually, the more that I keep looking back at that 2012 Supreme Court ruling where they made Medicaid expansion optional, I celebrated that day just because the Affordable Care Act was going to survive to enactment. And I looked at the Medicaid expansion becoming optional, and I thought, well, you know, we can make do. We'll work with it. Now that I look back at that Supreme Court ruling, I can't help but think to other Supreme Court rulings where what if they had said in Brown versus Board of Education, you know, this desegregation thing is going to be optional. We're going to let states just sort of figure this out. We're not going to have a national standard for decency in education. And that's kind of what we've done with healthcare. We've kind of done this thing where we are going to let state governors and state legislatures just put politics before patients and not agree to a standard of decency for healthcare as a basic human right. And so this is where we are now, where we've got some states that got their act together, expanded Medicaid, and now when they're looking at the Republicans' replacement plan, I do the air quote thing for the replacement because
there is no replacement.
There is no replacement, number one. Number two, the bad ideas in their rough draft forms that we've gotten exposure to, you are never going to be able to cover 90% of American people under what they're drawing up. You just simply cannot. When you block grant Medicaid, you're going to cut people out of the program. About 20 million people are going to lose coverage.
Right.
Those 20 million people don't have anywhere else to go. When you decide that you're going to, eliminate essential benefits from insurance plans, you have now opened up this ugly Pandora's box of these really crappy plans. I mean, we're talking about the kind of coats where, it's got 2 sleeves, Alex. It might not come down to your wrist, but it's got 2 sleeves. And you won't know how ugly or horrible your coat is until it starts snowing and you're out in the cold. But hey, you got it for a great price.
Right.
And these are the things that I feel that the average American, when they're looking at, these replacement plans, we need to scrutinize them hard.
Yeah.
And that's why I'm very encouraged by my fellow Americans showing up at these town hall meetings, demanding to see the plan and to know what these guys are up to.
Here's the thing. And I laid out all that. I'm proud. But it's telling that there is nothing to the right of premium supports in Obamacare.
Yeah.
They don't have anything else. That's the thing.
Yeah.
Obamacare is the most expansive version of a conservative idea.
Absolutely.
And so all the Republicans can do is make it less expansive.
Right.
They don't have a replacement. They're just going to punch holes in Obamacare, and it'll be Ryan Care or Trump Care, and it's just going to be worse Obamacare.
It's actually going to be Tryin' Care.
It's going to be Tryin' Care. That's exactly what it is.
Where you try, they don't care, and we just keep on trying. That's all it is.
That's it. And real people will get hurt. Real people will die because they lose their health care.
Absolutely.
And that's why you and I and millions of Americans are going to keep fighting.
Yeah.
Like I said, we started December 7th, I think was that.
That's right.
But the starter's gun is firing on Wednesday.
Yeah.
We will know just how bad their plan for Tryin' Care is.
Yeah.
It's a non-existent plan.
Right.
Otherwise, they wouldn't have had that whole hidden
room.
room.
Yeah.
You don't hide things from the people because they're so good for them.
Yeah. Unless you're trying to build the Death Star, which I mean,
maybe that's what it is.
Yeah.
Maybe they're actually trying to build the Death Star is what's going on.